Hello everybody, my name's Ben Ryrie. I work for East Midlands Ambulance Service as a County Coordinator and Training Officer. If you've never actually been through a training course on CPR, then please watch this for the next 15 minutes or so. A cardiac arrest is where the heart stops completely, and it can happen anywhere to anyone. 4 out of 10 of you watching this video probably have never done any training whatsoever, and so it will make a huge difference. So as I mentioned, this can happen anywhere and to anyone. And it's important that you stop and think that you could save somebody's life. So many of you would have actually been on training courses and learned doctor's ABC as part of it. We have to remember though that we are in a pandemic. So we're going to change that slightly. And if you've never seen the new process about how to save somebody's life in the pandemic, then now is your chance to go through that process. And that's what we're going to do next. We're going to start the process about trying to save somebody's life. Remember, this can happen anywhere and to anyone. So we're going to start off about you yourself. Remember, anywhere can mean you can be in any environment and you need to make sure it's safe. So our starting point is D for danger. Danger to me, to the patient, and to any bystanders around. And we can't start helping this patient until we are safe. So we don't know whether this patient is actually decided just to lie down here and fall asleep. So we're going to check for a response. So that's our second step. To do that, we're going to use just the shake and shout process. So we're going to go, hello, hello, can you hear me? I'm going to shake slightly on the shoulders and try and get to see if I can get a response. So we've got no response. So whatever is wrong with this patient, they are going to need some help. And so here we're going to shout for help. And by that I mean call 999. Our next step is whether the patient is breathing. And if you've done this before, this is the big change to the process itself. So breathing checks now, we're not going to get too close to our patient. We are simply going to see if we can see a rise and fall of the chest. We also have to remember that we might be able to hear without trying to get too close to our patient. Remember, breathing is a natural in and out and in and out. So it's not in and out and then nothing for a long period of time. Normal breathing is that regular intake of breath, and that's what we're looking for. So our next step is Cardiopulmonary Resuscitation, or more commonly known as CPR. CPR is about us pushing down on the chest of the patient. But in the pandemic, we want to just make sure that we reduce the risk of any transmission of COVID-19. So to do that, we are going to take any old bit of cloth we can find and just cover the nose and mouth of the patient. And then we can move on to our CPR. So CPR is about us creating a firm base and a firm structure for us to deliver a compression on the chest. To do that, we want to put this arm straight out as far as it will go. It's this bit of the hand that we want into the center of the chest. We will then put our other hand over the top. We will then put our entire weight over the top of the patient. Can you see how I'm pulling my fingers up and putting the base of my hand onto the chest of the patient? We then want to push at about 100 to 120 beats a minute. We also want to go a third of the depth of our patient's chest. So a bit like this. We will continue to do that, and we will keep going. In the past, any of you who have done this before would have stopped after 30 to give 2 breaths. In this environment, we are not. We are going to just continue pushing on the chest. Third of the depth at a beat of around 100 to 120. Remember, you don't stop unless you're told to by a paramedic, unless your patient comes around, or whether you physically can't carry on. So my last point about CPR and working to try and save the life of a patient is that for some people you might be asked to go and get a defibrillator. Now, a defibrillator are contained in these yellow boxes you see all over towns these days. Don't think about going to get it, because the ambulance service 999 call handler will advise you whether it's appropriate, and then you can send somebody else to go and get it. Because the most important thing you can do is push and keep pushing on this person's chest. But if somebody goes and gets it, I'm just going to show you what it's like and what the sort of things that it will say to you, so that you're familiar with it if you ever have to go and get one. Our starting point then is that you must continue to push on this chest. Don't stop for anything. So let me play with the defib here. This is an example of an automated external defibrillator, or an AED. So what you do with any of these is try and find out how to turn it on. With this particular one, it's simply just open the machine itself.
Adult mode. Remove all clothing from patient's chest.
It tells you what to do. I'm going to remove the clothing from the
Pull
patient's
handle
chest.
to reveal pads.
I've got a nice clean
Look at
chest.
pictures on pads.
It asks me to remove
Apply
this,
pads to bare skin exactly
and it reveals a
as shown
set
in the
of
pictures.
defibrillator pads.
Press pads firmly.
On the pads themselves, you can see that there are a picture of
Apply
where they
pads
should
to
go.
bare skin exactly as
So you
shown
apply
in the
them to
pictures.
bare skin exactly
Press
as
pads firmly.
shown on the
Apply
picture
pads
itself.
to bare skin
So
exactly
here,
as
this one
shown
down
in the pictures.
underneath the armpit.
Press
Once
pads
they're on,
firmly. Do not touch
it
patient.
tells me not to touch the patient. It's now assessing the
Analyzing
heart.
heart rhythm. Motion detected. Stop motion. Analyzing heart rhythm. Everyone clear. Press flashing button.
So it's found something to shock, so I make sure everybody's clear and I press the shocking button.
Shock delivered. Provide chest compressions.
It now
to
tells me to get back onto the chest and provide those chest compressions.
The other hand should be on
And
top
that
of the first hand.
is broadly what the machine
Push
does.
down.
So that gives you a flavour. It starts off by telling you to clear the chest, to put the pads on. It then analyses that heart, and then eventually will deliver a shock if it's required. It may turn around and tell you no shock advised, in which case just keep pushing on the chest. So thank you for watching that. Remember, if you're one of the 4 out of 10 people who've never had a course in this at all, then I hope that's helped you understand this is the way to save a life. Remember that this can happen anywhere to anyone. We went through that process, didn't we? Danger, gain a response, shout for help if there's no response by ringing 999. See if you can see if this patient is breathing, and if they're not breathing, then start pushing on the chest, 1/3 of the depth, 100 to 120 beats per minute, and keep going. Don't stop. Thank you.